माझे केस अचानकपणे खूपच कमी झाले होते. तर मी आज 20 ऑक्टोबर 2018 पहिल्यांदा माझ्या केसांवरती प्रत्यारोपण करणार. तर ते इथल्या मध्यभागी नंतर प्रत्यदर्शनी ठिकाणी खूपचपणे केस कमी झाले होते. तर मी याच्यानंतर माझ्या केसांवरती जसे जसे केस येतील तो अनुभव मी तुमच्यासमोर शेअर करत राहणार.
Androgenic alopecia, grade 5 to grade 6 alopecia we can call it. So he has recession of the hairline on both sides, both temporal recession, plus he also has thinning of the hair in the frontal part, also in the crown part. So vertex and crown both are in both part there is alopecia. So now what we are planning is FUE by type of hair transplant for him. We will be taking hairs from the back using the FUE technique. And now I will be marking his hairline as per his facial proportions, and then we will be doing FUE for him today. Front density, side hair, temporal hairs are okay. Crown part is almost lost, you can comb it. Also, if you could see the vertex part, there is thinning on the central part. Current hairline. The face is divided into 3 equal parts. This is equal to usually this is equal to the vertex part. So in this case we will see this is around 7 centimeter. Center I will just mark for him. This is bit short, mid portion is bit short, that is 6 centimeter. So we will consider 6 centimeter as his forehead length. So this is what is his frontal hairline. Now coming to temporal side, we have to mark it equally on both sides so that the hair line is symmetrical. Here it is coming 6.5, and on the lateral aspect of the eyebrow vertically for natural resemblance. If we give it in a straight line, it will give unnatural appearance. Also gives loss of hair on the temporal aspect. Super dense hair transplant in the frontal part, and then the dense part in the back side. So this front zone, which I am again marking, will have a super dense hair transplant. See, I am planning for total 3000 grafts for him to 3500 if we get that much. So front part we will be putting this around 3000 grafts plus temple region, and in around this crown part we will be putting around 500 grafts. This is what is our plan. Okay, I will just show the patient. We will show this marking to the patient and confirm with him. See, this is your hairline. Okay, this, if you have any queries you can ask. This is your frontal hairline. This is what we mark it irregular. We are going to come in front and back of this to make it irregular. Okay. Exactly. Now this is very common question everybody asks, that I want hair in this part. Okay, this is temporal recession. We need to maintain this angle so that it resembles the normal hairline. Now if I try and cover this, okay, just me cover killer suppose, then it will look like a feminine hairline, because if you lose this angle, it won't look natural. Okay, I will just show on his just. Okay, I'll show you his back hairlines. If you go, see, got it? So this is what is there. So this is what looks natural.
Yes, sir.
Okay. Second thing, if on this side also, if you see, got it? What you are asking me to fill this, he's asking me to fill this. If I fill this, the hair will come down here. Okay, it doesn't look natural.
Yeah.
Got it? One more thing. Got it? One more thing. If many patient ask me to take the hairline down, so if I take hairline here, your hair will come till here. If I take it very down, the hair will come till here. Now again in the same patient, if you see his hairline, his hairs are seen here. Okay, down. So if we look at his, this hairline is starting here, but we feel like that it's still here. Got it?
इथून येतं ना सर.
This is इथून. grafts from the donor side, back side, and we had made bunches of grafts. We have actually sorted this. The graft with the roots only are taken into this, and we had made one bunch of 20 grafts, and this is the line of 15. Okay, so this each row is 300 grafts. So these total rows are 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, so these are 3000. This is one graft. This is 2 follicles. So as you can see, this is the front line we have marked. In the front 2 to 2.5 centimeter, this is a super dense slitting. This is the slitting. This is done in the particular direction of the hairs. Okay, so you can see the slits. Okay, very closely placed dense slitting. The density slightly decreases in this part, and then it further decreases in the posterior part. So we have covered this much of the area. Also, we have given slitting in the temporal part. You can see on the either side we have done slitting on the temporal part. One more thing to be noted is that we have done some irregular slitting. So this is the to make the line irregular, so that the natural hairline is always irregular and wavy. So we are doing it that way. We have given anesthesia in this part. Patient is absolutely comfortable. बरं वाटतंय तुम्हाला?
हो सर.
काही त्रास?
काहीच
Perfect.
परफेक्ट.
Okay. So now we will be starting with the implantation part.
ऑपरेशन झालं होतं, तर त्यावेळेस मी तुमच्यासमोर पण व्हिडिओ शेअर केला होता. माझी इथे केस खूपच कमी होते. त्याच्यानंतर इथले केस काढून माझ्याकडे इथं समोर लावण्यात आले. तर मला आज 2 दिवस झाले ऑपरेशन होऊन. मी एकदम ठीक आहे आणि कुठल्या प्रकारे मला त्रास पण होत नाही. आणि आज मी 2 दिवसानंतर पुन्हा एकदा सरांकडे आलो आहे इथले केस वगैरे काढण्यासाठी. ते सरांनी ती मलमपट्टी वगैरे काढून तिथं मला ट्यूब वगैरे लावलेला आहे. आता इथे आपण पाहू शकता इथे. आणि मला यात म्हणजे मुळात कुठलाही त्रास होत नाही मला. म्हणजे मला डोकं पण दुखतं नाही किंवा माझे जे दैनंदिन काम आहेत मी ते करू शकतो रोजच्या रोज.
Okay, so today is post-op day 2 of FUV technique hair transplant. We have removed his donor site. Okay, we have put around total 3,500 graft for his crown area, vertex area, and both side temporal region. You can see the scalp is quite clean. Okay, there are minor some scabs attached nearby, and I'll show you the donor area also. So this is his donor area, which is quite dry and heat. We have applied betadine ointment over the donor area so that you can see it actually in yellowish shade. So he is very comfortable and he has joined all his daily work also. Comfortable है? काही त्रास?
काहीच नाही.
कामावर जायला चालू केलं?
सुरू केलं.
So he is already joined his daily routine work. He is comfortable also. This is the dynaplast that we have kept till now. So we will be removing it after 2 days. This is kept so that this edema won't seep down and he doesn't have any facial or periorbital edema. So this is the purpose of this tight dynaplast dressing. This will be removed in next 48 days and he will take the overhead bath after 2 days. That is after 4th day after the hair transplant. We will keep on sharing his